a patient like this who has high-risk features and are young and fit, I think that we've done a remarkable CLL progress recently has been remarkable. And previously when we took a young fit patient with 17p deletion who relapsed after FCR therapy back in the day, their overall survival was somewhere between 9 and 12 months. This is completely different. This is why drugs like a Bruton and venetoclax have been approved. When ibrutinib got approved, all of a sudden, folks like this, their PFS was better than chemoimmunotherapy ever was for these individuals. And so we're prolonging the survival of patients with CLL. So it's a wonderful time period. I mean, for folks because of all the different therapies that have come out and targeted therapies, and now we're tweaking them and looking at minimal residual disease. How do we get people off these therapies? It's an exciting time for patients because the availability of all these therapies. It's an exciting time for individuals like myself who do research in CLL because we're really trying to push the field forward and at much quicker paces than we ever did before in the era of chemoimmunotherapy. Do I think we have a long way to go? I do. Not a bad thing. It'll be the next generation of docs who will hopefully do this because I think it will in a good way. I think what I'm trying to say is that some of these therapies will hold patients for years, which means that for us to then change things in a meaningful time period may take us much longer, which means these therapies are doing right by the patients and prolonging their lives for much longer. And so finding some of these answers may take us a lot longer as investigators. But I think it's a wonderful time period, and we have lots of different areas to explore with how to combine and sequence these agents. How do we look at immunotherapies and CAR T cells? Where do we move that for patients who need treatment given the era of all these new agents? Where do you place those types of therapies? So it's an exciting time going forward, and I think it should only highlight the fact that with patients who are going on some of these clinical trials, we can't thank them enough for participating, and the future of CLL is very bright.